Welcome to the Foundation Trust Network Annual Conference 2013, where NHS leaders come to find out about policy and decision making within the healthcare sector.
We're all going through difficult times and people want to learn from people's experiences. They want to share from people's experiences and they want to network. One of the things I've noticed as I travel up and down the country is there is more fragmentation now of the leadership community, and I think events like this are so important to make sure people stay connected and talk about the latest and best ideas.
It's a great opportunity to bring together the whole of the foundation trusts in one place. That opportunity to share learnings and to engage with that group. The speaker list is fantastic and has really been quite thought-provoking in some of the challenges that the NHS is facing.
There are very few things that are more important to the British public than the NHS. It's an absolute jewel in the crown. And some of the debates that I've been hearing, that I've been chairing, have really gone to the nub of some of the main issues.
One of the significant global trends that I'm observing is the concept of using home as the hub of healthcare. Now clearly you have to be careful when you say that because people couldn't be having neurosurgery in their living rooms. But there are many ambulatory procedures such as chemotherapy and indeed dialysis where people are having their care taken out of hospitals and move closer to their home.
I think you need to look in your health economy about what makes sense, what can be delivered safely, and make sure you're having that conversation with patients about reassuring them about why that will give the kind of quality of outcomes that we're looking for, rather than particularly focusing on one specific pathway over another.
Most people don't want to be in hospital. Most of the contact, in fact, is with people in the community rather than in acute trusts, which I think we forget. The vast majority of contacts are with patients in primary care or in community hospitals. So I'm really keen to continue that shift and in a sense get rid of some of the blocks which stop that from happening, that shift occurring.
Clearly, there's an awful lot of people in acute hospitals who shouldn't be there.
In some ways, it doesn't really matter where the care is as long as it's close to home. A building is a building at the end of the day. It's about getting the clinician, I think, as close to the patient as possible.
Patients are at the centre of the NHS, and if they're not, they ought to be. A lot of the discussion has been about how you ensure that keeps happening, how you keep patients at the centre at this time of reduced money. And some of the ideas have come from abroad. They've been really interesting. Can you take examples from India and from Mexico and apply them here? I think there's a certain amount of scepticism. But I think what people are doing is really looking far and wide at new ideas and seeing if they can apply them. And that's fascinating to watch.